We've got some breaking news here. Stephen Marshall, the South Australian Premier, has closed the state's borders. 14-day mandatory isolation for visitors. Here he is speaking.
Coming across the borders for holidays, but also for business that should be avoided. Of course, we've got to keep the state moving, and we can't turn everything off, so there will be some sensible exemptions, but these will be very few and strictly administered. But what we're trying to do here is to massively reduce the peak of the coronavirus impact and push it out into the future as far as possible. That gives us the maximum amount of time to ensure that all of our critical health capability is in place to meet and exceed that expected demand. Where we see the coronavirus causing a lot of dangerous scenarios around the world is where the demand massively outstrips that country's ability to supply high-quality healthcare to meet that need. We do not want that to occur in South Australia, and that's why we're taking this strong and decisive action.
How are you going to enforce this? Are you going to have all of the entrances to South Australia patrolled 24 hours a day? How's it going to work?
There will be, the SAPOL will look after the initial 12 border control stations, so there will be no people coming in and out across those stations without reading the new order, making sure that they understand it and signing a declaration that they will self-isolate. We believe that this will massively switch off overnight, immediately, the number of people who are coming into South Australia from interstate. This will massively reduce the risk and it will slow the spread of this disease. We will seek the advice of the public health officials. As you could imagine, there's probably no greater scrutinised group of people in the entire country than AFL players, but we'll leave that decision up to the public health officials.
How do you call that essential travel, though?
No, I wouldn't call it essential travel, but what we are trying to do at the moment is to identify the high-risk groups and hit them as quickly as possible. So we know that what the highest risk cohorts in Australia are, and that is, at the moment, in South Australia, people coming from interstate, mainly on holidays, unbeknownst that they have this infection and spreading it, but also, importantly, South Australians going into high-risk areas, contracting the virus and then returning to South Australia. We need to do this with careful consideration of a risk management approach. That's the advice that we have received. I know that this is going to be hugely restrictive for many businesses and individuals, and so we do not make this decision lightly, but we have no choice. The advice was received this morning. We will be implementing this as soon as practicable, and from now on our borders are going to be closed unless people come into South Australia and self-isolate for 2 weeks. Now, what I'm going to do now is ask the Commissioner, the State Coordinator, to make some comments. And I do have to just let people know that we will need to leave just before 1 o'clock, because that is the time that we will be making this declaration of a major emergency. Commissioner.
Thank you, Premier. As the Premier has outlined, we have a plan in place where we will establish checking stations across 12 major entry points. We know there are other less travelled access points to the state, but the endeavour here is to dramatically reduce the volume, and that's where we will be putting our focus. Our intention under the declaration is to utilise the resources of other agencies as well, so we'll be utilising staff from PIRSA and also the DPTI to assist in the process of establishing these checking stations and monitoring them over a 24/7 period. This is a substantial undertaking to implement very quickly, which is why Tuesday afternoon is the effective date for these checking stations, but we'll be implementing strategies between now and then to ensure people understand their obligations to self-isolate as they come into South Australia before those checking stations are fully up and running.
What do you have over the 2 weeks? This is an honour system essentially that we have at the moment, that people do the right thing, but we're getting sort of more messages than we can follow up, that people are wanting to dob in people doing the wrong thing. They're contacting SAPOL. SAPOL are saying contact SA Health, and SA Health say we don't have the ability to enforce that. What do people do?
We are actually doing random checks of people who are required to self-isolate, and so far that's been people who have returned from overseas. We are doing a number of checks every day, and I think it's reasonable to acknowledge that we can't check every single person with the volume of people who have returned to South Australia. And with this new strategy being implemented, there is no capacity to check every person, and we are relying on people's community and sense of goodwill to do the right thing. Those people who have information regarding people not complying with their self-isolation requirements have been contacting SAPOL as well. We are referring that information to health so we can risk assess the need to actually follow up with further action against those people.
That's the South Australian authorities there announcing that they will shut their borders. Anyone that arrives has to be essential travel. Those that aren't will self-isolate for 14